Breast cancer is the commonest cancer in a woman. Everyone is born with some breast tissue. Hence, breast cancer is not only seen in women. 1 in 1,000 men have a lifetime risk of developing breast cancer. The female breast is primarily made up of lobules, ducts, adipose tissues, and connective tissues. Each female breast contains 15 to 20 such sections called lobes, and each lobe is made up of many smaller sacs called lobules, which is responsible for milk secretion during breastfeeding. The lactiferous ducts. Now, these lobules they meet the lactiferous ducts, and the lactiferous ducts empty or drain into the nipple. Now, we need to have a basic idea about the anatomy as we are going to discuss about the types of breast cancer. First type is ductal carcinoma in situ, that is DCIS, which means the abnormal growth. Now, this is primarily restricted to the ducts, okay, lactiferous ducts. So ductal carcinoma in situ, which means the abnormal cells, abnormal growth is restricted only inside the ducts, okay. However, when there is disruption of the basement membrane layer of the ducts and the abnormal cells spill out of the duct, it is transformed into invasive ductal carcinoma, that is IDC. So when the abnormal growth is only inside these ducts, it is called ductal carcinoma in situ. And when it spills and spread to the other parts of the breast, it is called invasive ductal carcinoma. Okay. Similarly, when we have abnormal growth restricted to the lobules, okay, when we have abnormal growth restricted to the lobules, it is called lobular carcinoma in situ, that is LCIS. And when it spreads to the surrounding tissues, it becomes invasive lobular carcinoma, ILC. Other types of breast cancer, we have inflammatory breast cancer and triple negative breast cancer. Now, triple negative breast cancer means that the tumor does not have estrogen, progesterone, or human epidermal growth factor 2 receptor on its surface, like HRE2 receptor. Okay, that is the human epidermal growth factor receptor. Other types of breast cancer include HRE2 positive breast cancer. HRE2 positive breast cancer is a type of breast cancer that is higher than normal levels of the human epidermal growth factor receptor 2 protein, that is HRE2 protein. This protein controls how breast cells grow and divide, and when breast tissue has too many HRE2 receptors, the cells can multiply too quickly. Then we have metastatic breast cancer. Metastatic breast cancer is a later stage of breast cancer where the cancer has spread to other parts of the body. Now let us discuss about the risk factors for development of breast cancer. First we have is family history. Now if the woman has a family history of breast cancer, she might be at an increased risk of developing breast cancer. Next we have is inherited gene mutations, that is BRCA1 and BRCA2 gene mutations that can again increase the risk of breast cancer. Next on the list is older age. Elderly women, especially in their 60s, are at an increased risk of developing breast cancer and is very common in the sixth decade of life. After 60 years of age, 50% of breast lumps prove to be malignant. Next we have is nulliparity. Now along with nulliparity, we also have late first pregnancy after 30 years of age, non-lactation, early menarche and late menopause as the risk factors, as these conditions expose the breast tissues to estrogen hormones for an increased time frame and make them susceptible to the development of breast cancer. Now, the same thing I had discussed in my previous video where we were talking about ovarian cancer like nulliparity, early menarche, late menopause. Why are these factors posing as a risk factor for development of these cancers. That during the reproductive life, the woman is exposed to estrogen for a longer period of time, that puts her in an increased risk of development of these cancers. I would like to request you to go and watch the video of ovarian cancer as well to get a better understanding. Next, we have obesity. Now, obese women do have a propensity to breast cancer. Next, we have is smoking, which again puts the woman at an increased risk of developing breast cancer, as smoking encourages periductal mastitis and atypical growth, and it is also immunosuppressive. Alcohol again could be a risk factor for development of breast cancer. Other risk factors include combined oral contraceptive pills and ovarian cancer. Now, a woman with ovarian cancer is at a high risk for developing breast cancer and vice versa, because both the malignancies share common etiological factors and have a common oncogen. Like I have discussed just in the previous slide, that nulliparity, early menarche, late menopause, these are the common risk factors that ovarian cancer and breast cancer share. So both these cancers have common etiological factors and also common oncogen. So a woman with ovarian cancer should be screened for breast tumor, as the ovarian tumor could be a metastasis from the breast, and vice versa. A woman with breast cancer should also be always screened for ovarian cancer. Let us talk about the signs and symptoms of breast cancer. First on the list is breast lump, lump in the axilla, that is in the armpit. There could also be nipple changes. The nipple could be retracted. The woman may also experience nipple discharge and pain. The discharge could either be clear or bloody. There could be skin changes, dimpling or puckering of the skin over the breast, also called as spotty orange skin. That means the skin over the breast becomes similar to the skin of an orange. There could be redness or flaky skin in the nipple area. There could also be swelling and pain over the breast that is not subsiding. Investigations for breast cancer includes a thorough clinical examination by the doctor. Mammography is a great investigation tool but is contraindicated in pregnancy because of the risk of radiation. However, using only mammography as the investigation tool is unreliable in 50% women below 40 years of age because of dense breast tissue. Hence, your doctor may also suggest an ultrasound examination of the breast, which is useful in all age groups. Ultrasound, however, fails to identify microcalcifications, which is the hallmark of early cancer. MRI may be suggested as it gives the most accurate measurement of the tumor size of invasive cancer and also help in staging. FNAC, that is fine needle aspiration cytology under ultrasound or clinical guidance, yields cellular study of the lump. Now let us see the treatment for breast cancer. The treatment basically depends on the type and stage of the cancer. The final treatment protocol will be decided by the oncology team. However, these are the major treatment options: surgery, chemotherapy, radiation, hormone therapy, and immunotherapy. The surgical options include lumpectomy, simple mastectomy, modified radical mastectomy, prophylactic mastectomy, mastectomy with reconstruction, etc. Chemotherapy is given in the form of neoadjuvant chemotherapy, which is usually given before surgery to shrink the tumor, adjuvant chemotherapy after the surgery, or as palliative chemotherapy. Radiation is usually recommended after surgery or even after chemotherapy. Hormone therapy is usually given when the tumor is positive for estrogen or progesterone. Immunotherapy for breast cancer is a treatment that helps the body's immune system fight cancer cells by using medicines to strengthen the immune response. Hope this information was useful to you. Do consider to like, share, and subscribe to the channel, and follow me on Instagram for more such helpful health related topics. Thank you.